How do you monitor DMT side effects? Monitoring the side effects of disease-modifying therapies for multiple sclerosis is crucial for ensuring patient safety and treatment effectiveness. It involves a combination of clinical assessments, laboratory tests, imaging studies, and patient-reported symptoms. This approach helps to catch any potential issues early on. First, routine laboratory monitoring is essential. Blood tests are typically performed at the start of treatment and then at 1, 3, and 6 months after beginning therapy. After that, tests are done every 6 to 12 months during maintenance treatment. These tests usually include a complete blood count, a comprehensive metabolic panel, and thyroid-stimulating hormone levels. For some therapies, liver function tests are particularly important. For instance, drugs like sphingosine 1-phosphate receptor modulators may require close monitoring of liver enzymes, as elevated levels can lead to therapy discontinuation. Next, clinical monitoring is vital. Regular visits with healthcare providers allow for the assessment of common side effects, such as injection site reactions, flu-like symptoms, and fatigue. Blood pressure monitoring is also important for patients on certain therapies due to potential cardiovascular effects. During these visits, healthcare providers will evaluate any neurological changes or worsening symptoms to differentiate between side effects and disease progression. Imaging studies, particularly magnetic resonance imaging scans, are routinely used to monitor disease activity. These scans can also detect rare but serious complications, such as progressive multifocal leukoencephalopathy, especially in patients on higher-risk therapies. Additionally, optical coherence tomography or eye exams may be recommended shortly after starting certain medications to monitor for conditions like macular edema. Cancer and skin surveillance is another important aspect. Patients on specific therapies may need routine cancer screenings, including pap smears and dermatologic examinations, due to an increased risk of skin cancers. It is also advisable for patients to perform self-examinations of their skin every 3 months. Patient education and adherence to treatment are key components of monitoring. Discussions about medication adherence and understanding treatment goals help patients manage their expectations regarding side effects and benefits. Patients should be encouraged to report any new symptoms promptly and to keep regular follow-up appointments. Special considerations also come into play. If a patient discontinues a disease-modifying therapy, clinical and radiographic monitoring should continue at least every 6 months to check for disease reactivation. Additionally, careful management is needed during washout periods between different therapies to balance the risk of relapse and immunosuppression. For women who are pregnant or breastfeeding, certain therapies may need to be avoided, and contraception is often recommended during and after treatment. In summary, monitoring the side effects of disease-modifying therapies for multiple sclerosis is a comprehensive process. It involves scheduled laboratory tests, clinical evaluations, imaging studies, and active patient engagement. This multidisciplinary approach helps to detect adverse effects early, ensuring safety and optimizing treatment outcomes. Always consult with healthcare professionals for personalized advice and management strategies tailored to individual needs.